Now we're going to talk about the nematodes that are acquired or transmitted by eggs. We have Enterobius vermicularis, Ascaris lumbricoides, and Trichuria. And also Toxoplasma, Toxocara canis. In Enterobius vermicularis, the disease is just scratching in the anal area. Usually is seen in children. Here the eggs are ingested, then mature into larvae in the GI tract and migrate through the GI tract until the anal area, and then the female larva deposits the eggs in the anal area, and then the patient scratches in that area, and then if with the hand now contaminated takes some food or something, now is inoculating again the eggs, so it's auto-infection. This is it's not severe disease, but it's extremely contagious. So when the patient patient is diagnosed with this, all the family should be conscious. Everything needs to go to disinfection, the clothes of everybody, everything. The treatment is Pyrantel, Pamoato, or some Bendazole. The diagnostic is made with a cellophane tape plate or paper that is put in the child in the night when the larva is going to deposit the eggs, and so in the morning, then the physician looks and will see the eggs. Next, for Ascaris lumbricoides, the same as Enterobius vermicularis, stays in the GI tract until there all the life, and here these symptoms are because of obstruction, and produces nausea, vomiting, intussusception, volvulus, biliary tract obstruction, etc. Here the life cycle of Ascaris lumbricoides is similar to that of the Strongyloides circularis and Necanthor americanus and Ancylostoma duodenale. Just as here is the eggs that are ingested, they mature into in the GI tract. They can go into the blood or into the lung, and then are swallowed and things along that line. And again, now they're in the GI tract. The diagnostic is made with seeing the eggs in this stool. Here are coated eggs with 6 to 12 of the roundworms of these Ascaris lumbricoides. The treatment is with mebendazole or some albendazole. Albendazole now is used instead of mebendazole in the United States. Next, for trichuria, there is ingestion of the eggs. The eggs convert into larva, and the larva migrates and adheres to the mucosa of the GI tract and can migrate specifically to the rectus, the ciego, and the appendix, so can cause appendicitis or rectal prolapse. This is the most common presentation, and pathognomonic for this parasite is the rectal prolapse. Also, this is more commonly seen in children. Next, for Toxocara canis, this is acquired by ingesting the eggs from undercooked meat or chicken, or from interaction with cats and dogs. So they are contaminated and they infect the patient, usually again a children. These larvae can migrate through all the parts of the body, so this is called visceral larva migrants, and can go to the brain, to the heart, to the eyes. With eyes would be just visual impairment. In the brain, the patient would have coma, and in coma or seizures, and in the heart, the patient would have myocarditis. Here the treatment again is also some albendazole, and the diagnostic is made with serology and eosinophilia. And so every one of these is treated with albendazole. Just enterovirus vernicularis can be treated with Pyrantel pamoato. The diagnostic is made here with the paper, here with seeing the eggs in the stool, and serology here. And for trichuria is also to see the eggs in the stool.